Hello friends, on behalf of Progressive Education Society's Modern College of Pharmacy Nigdi Pune, myself Dr. Narendra Parihar, Assistant Professor, I welcome you all. Today's lecture we will see Community Pharmacy Management. So what is the content of this chapter? Definition, types of community pharmacies, scope of community pharmacy, roles and responsibilities of community pharmacist, establishment of community pharmacist and activities conducted at a community pharmacist. So what are the learning outcomes? Student will be able to understand the basic knowledge about pharmacy, understand the scope of pharmacy, will be able to know the roles and different responsibilities of a pharmacist, establish and run a pharmacy after education, understand the different documents required to open a pharmacy, and to conduct different health promotion activities at community pharmacy. So let's start with the introduction. The community pharmacy medicines management is a unique point with an objective to introduce a structured intervention process into the relationship study between the community pharmacist, the patient, and the general practitioner. It is a pharmacy that deals directly with people in the local area. It has responsibilities including compounding, counseling, checking, and dispensing of prescription drugs to the patients with care, accuracy, and legality. Community pharmacy is defined. It means any place under the direct supervision of a pharmacist where the practice of pharmacy occurs or where prescription orders are compounded and dispensed other than a hospital pharmacy or a limited service pharmacy. It includes all the establishments that are privately owned and whose functions is to serve the society's need for drug products and pharmaceutical services. So let's see what are the different types of pharmacies. First is owned, means a person has his own pharmacy. Second, chain pharmacies. As we have seen in our day-to-day life, wellness pharmacies, Apollo pharmacies. So these are all under one organization, or you can say under one umbrella, which is organized and managed by one person, and he keeps a different organizations to manage this pharmacy. Third, as we all know, Pradhan Mantri Modi ji, they have came up with new idea, that is Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana Kendra. Means here the Jan Aushadhi Kendras where generic medicines are sold to the patient at lower cost. Next, hospital pharmacies, means you have seen the pharmacies which are attached with within the hospital or with hospital. And last is a ISIC. ISIC is a Employees State Insurance Corporation. These pharmacies are controlled and managed by the state government, or you can say central government. So these are the various types of pharmacies which you should know. Let's move on. Next, scope is of pharmacy, means scope of community pharmacy. So what is the scope? In processing the prescriptions, clinical pharmacy, patient care, drug monitoring, extemporaneous preparations, alternative medicines, checking symptoms of minor ailments, healthcare professionals, advancement in research and technology, that is newer drug in market, disease prevention and health promotion in society. Now, as we have seen in first video, the different roles and responsibilities of community pharmacies. So first is dispensing prescription medicines to the public or patient, ensuring that different treatments are compatible, checking dosage and ensuring that medicines are correctly and safely supplied and labeled, supervising the preparation of any medicines, keeping a register of controlled drugs for legal and stock control purposes, liaising with doctors about prescription, selling OTC medicines, counseling and advising the public on the treatment of minor ailments, advising patients of any adverse side effects of medicines, measuring and fitting comprehension history, monitoring blood pressure and cholesterol levels, offering a diabetes screening service, arranging the delivery of prescription medicines to patient, that is home delivery of drugs, managing, supervising and training pharmacist support staff, budgeting and financial management of community pharmacy, and keeping up to date with current pharmacy practice with newer drugs and their uses. So these were all the roles and responsibility of community pharmacy. Now we will see the different parameters which are involved in establishment of community pharmacy. First, finance, purchasing and inventory of drugs, selection of a location, or you can say site selection of a pharmacy, where to establish or where to start our community pharmacy. How should be the layout and interior of pharmacy? What are the legal requirements or what is the staff required for a community pharmacy? Different storage conditions for various types of drugs. How to arrange a stock in a community pharmacy? What are the various documentations which are required to establish a community pharmacy, or you can say to run a community pharmacy? And what is the use of computer in a community pharmacy? Okay, so these are all the parameters which we are going to see one by one. So first, financing is required to set up a new community pharmacy in order to maintain the medicine stock and cover the expenses. So what is the purpose of finance? To purchase land, building, machinery and equipment, to purchase raw materials and other materials, to pay the salaries of the staff, wages and incidental charges, and to maintain stock and supply products. So what are the sources of finance? First is own finance, means it's own our own money, and second loan finance, which can be borrowed by the bank or you can take loan from the bank. Now, capital. Capital is the wealth or asset used in business enterprise to produce income. Different types of capitals are cash, bank deposit, our own property, you can say house, etc. So types of capitals are two: working capital and fixed capital. So working capital, it includes cash on hand, inventories, marketable securities, etc. Means you are purchasing the drugs, you are selling to the patients and you are getting profit. Then again you are purchasing drug, again you are selling the drug. Means it is a working capital. It is not stable. Second is a fixed capital. So it includes properties like land, building, plant, machinery, etc. So in this the furniture will come, your shop will come. So these are all fixed capital, means here the money is not in a rotation. So inventory control. Inventory control, or you can say stock control, is the activity of checking stock of the community pharmacy. So it is a system or it's a technique which helps to determine how much stock to hold, when to place order and how many quantity to order for smooth operation of a community pharmacy. Next we will see purchasing. So purchasing is the process of buying the right quality, quantity of drug at right time and right price. So good purchasing is very essential to make the community pharmacy a success. The principle of purchasing states that you buy yourself poor and sell yourself rich. So what are the objectives? Consistent supply of the material to the patient, maintaining the standards of quality, avoidance of duplication, wastage, etc. Maintenance of buyer and supplier relation, means retailer and wholesaler relation. Proper record keeping, means if we are buying some medicines from market, we have to make proper arrangement of these bills which are required for a drug inspection. So what are the methods of purchasing pharmaceutical products? Purchasing by the requirement, mean when it is required we should purchase the medicine or a drug. So products are purchased when necessary and in exact quantities required. For a specified future period, products are purchased for a limited time in a contract basis. Purchasing from favorable market. Speculative purchasing. Products are purchased when price of the products goes down and sold when prices rises. So this type of speculative purchasing is means, like for example now corona situation is going on. So there is a more demand of sanitizers and you can say mask and gloves. So it depends on the situation. So contract purchasing. Products are purchased by direct contact and ensures conditions supply of the products. So contract purchase has a fixed delivery date and price. Purchasing small items in groups. Products are purchased in a small quantities when required. It saves the larger expenses, or you can say investment of money. So purchasing procedure. Purchase requisition. The list of products to be purchased is made on the product flow and patients requires. Selection of the supplier. The right source is selected based on the quality and economic values. Placing an order. After requisition slip, the supplier selections the order is placed in the desired date and time. Receiving and checking materials. The products received should be properly checked and verified for the condition and the quantity of the products received. Checking of invoice and bills. The invoice and bills of the products received should be checked and verified for quantity and billing amounts. Recording of bills. Proper record keeping of all the bills should be done for future use and audit purpose. Releasing the payment to the supplier. Next, we will see site selection or location analysis of a pharmacy. The location of a good community pharmacy should attract the number of consumers. Location can be classified into two ways, according to the geographical location and according to the functional location. So in geographical location, it is depend on urban and rural area. In urban area, the population in urban area is higher, having thick populations, residential area and meeting place. Hence, the higher investment is required for a pharmacy setup in urban area. In rural area, the population is fewer as compared to the urban area. It requires lesser investment. And the location should be at the market area where people come for marketing, physicians visit and to buy medicines. Second, functional location. First is a subscription location, means pharmacies are located at special place where customers visit by chance, usually away from home. Second, interceptive location. Pharmacy is located on the way to shopping centers, towards business houses, usually for business purpose. For example, near office buildings, etc. Means if person is working in IT center, so the IT center will be the interceptive location for to select the site for the community pharmacy. So good location determines the access to the public and the success rate of the pharmacy, whereas a poor location may cause failure of the pharmacy. So which are the major factors which are responsible for location analysis? Transport facility for raw materials, labor and products. Larger labor supply. Electricity and safe drinking water facility. Banking and financial institution. Availability of sources of raw materials, larger market, university, colleges, school, hospital and research centers should be near, cooperative and helpful community, and good industrial laboratory. So these are the factors which are responsible to analyze or to select a proper location for our community pharmacy. So location analysis for a community pharmacy. Location analysis is the selection of an appropriate site for the establishment of a community pharmacy. It is an important step in the establishment of community pharmacy. So for location analysis, before establishing a community pharmacy, following points should be considered. Population of the community. What is the population of that area? Income distribution among the populations. Type of pharmacy. Competitions, means how many pharmacies are already there in that particular area. So it should be competitive. Flow of traffic, means it should not be a one way. The traffic flow should be of two ways, means while going also and while coming also our pharmacy should be visible or easily attractive. Special services and consumer types and business locality. So here we have seen the first 2-3 points for establishing of a community pharmacy, that is finance, purchasing, inventory of drugs, location and site selections. Okay. Now in next video we will see the layout, interior of pharmacy, legal requirements, different storage conditions, stock arrangements, documentations and use of a computer in a community pharmacy. So thank you so much. Watch the next video.